Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. This year, I've been watching a lot of Wendy Murdoch's Webinars with Wendy, a webinar series she put on during the pandemic to connect with people and help get continuing education out there for horse owners and equine professionals. She even asked me to do a webinar myself, which I did in early November on the horse owner's role in hoof rehab. So if you don't want to listen to every podcast episode I've done, I condensed a lot of the information into a webinar, and you can find it on Wendy's YouTube channel. After watching other webinars with Wendy, I reached out to her to see if she would answer some questions for me about Surefoot pads on the podcast. I've been intrigued by Surefoot pads for years, ever since I saw them at Equine Fair in Massachusetts. I recently was able to get a half physio pad and have been playing with it with some client horses, and reached out to see if Wendy would be willing to talk with me about the ins and outs of these pads and how they help horses. So I obviously know you more from the Surefoot balance pads, but I don't know a lot of your history before creating those and using them to help horses. So can you tell us a little bit about how you became interested in, horses' posture and their movement and, how that ended up developing into the pads?
Sure. So just so you know, I had a horse on my first birthday cake. And when I was a little kid, all my birthday parties were at the local stables. So, when this started, probably in the womb. But I don't come from a horsey family. My dad had ridden a little bit in the war, but because he had to. And, we weren't a horse family, but they recognized my passion. And so my parents would take me to a local hack stable or, like I said, have pony rides for my birthday. And then I finally had, my mom gave me riding lessons when I was 11. And I then later bought a horse at 14. I came home and told my mother I bought a horse. That's a little bit of a shock. So, horses have been in my life. I can't escape them. They are my life. But Surefoot really started because of a happy accident. And it's the second time an accident has totally changed my life. And the first time was in 1984. So I went to University of New Hampshire, got a bachelor's degree in animal science, and then I went to University of Kentucky, and I was getting my master's degree in equine reproductive physiology. But at the time, I was also managing an event barn, and we brought these 5 horses up from Georgia, and I got on one that was a known rearer, and he reared up, hit me in the face, second time, flipped over, and then rolled over me and punched my femur through my hip socket. So instead of being an event rider, which I thought was what I wanted to do, I wound up in the hospital and had to have surgery. So while I was in the hospital, somebody gave me a Linda Tellington-Jones newsletter, and I realized that I had to get to a team clinic. And so a year after the accident, I met Linda. And she had studied with a person named Dr. Feldenkrais. Dr. Feldenkrais was an engineer and a scientist, and he created what's known now as the Feldenkrais method, which is his name. Which is, we all agree, is a terrible name, but it's his name, so that's the name of the work. And Dr. Feldenkrais was interested in helping people achieve their potential. And he studied all kinds of philosophies and psychologies and realized that you can't think a thought without a movement. You can't think a thought without a movement. And, those movements could be as subtle as moving your eyes or breathing, but we have movement associated with thought. And when I met Linda, she had studied with Dr. Feldenkrais and combined his information with her horse knowledge to create the Tellington-Jones Equine Awareness Method. And so that was the newsletter that somebody gave me while I was laying in the hospital bed. I read that. I got to a workshop with Linda a year after my accident. And I learned about the Feldenkrais method and about Linda and studied with her extensively from 85 to 92 or 3. But at my second clinic, I met Sally Swift. And it was in Washington, Connecticut at Kim Walness's place because she was going off to Australia to go to the World Equestrian Games in eventing. She had been working with Sally Swift, and so Kim had Linda come in and Sally come in, and I left I was in graduate school and had finished my master's and was starting on a doctoral degree in equine biomechanics. And I drove up there and I met Sally and worked with Linda. And the funny thing was that way back then, I finished my master's and I wanted to look at biomechanics. And Dr. James Rooney was one of my advisors. He'd written a couple of books on biomechanics. And I took a tripod up to this workshop at Kim's and I put dots on horses and I had them move in front of the camera. And then after we did some work on them, I had them move again. So, my thoughts about looking at movement stem all the way back to kind of this period when I was in graduate school and had my accident, met Linda and started looking at things and was trying to figure out a PhD, which was either going to be studying the horse's spine or navicular, but, I was interested in movement then. And so it's the only course I ever failed. It's the only course I've ever gotten an F in because I went back to university and all I had at the time was, okay, you have to remember this is 1986. Not sure you were alive then. And the Mac computer, the Apple, the little one had just come out. But to record the movement of the horses, you had to hand digitize, meaning you would move the video a frame and then you'd take a pen and you'd have to touch each one of the dots that you'd put on the horse to record it into the computer, and then you'd move the frame and do it all over again. So you had to hand digitize all of your data points. Well, by that point I was realizing that I wasn't sure I wanted to spend the rest of my life in cement wall, that I was more and more interested in what Linda was doing. I was, just ready to leave academia. So I quit. Never finished that course and I got an F. But I'm still doing what I was doing back then. I'm still looking at horses' movement and looking at the change in movement. So I think I have to say that my interest in biomechanics all goes back to my graduate degree and working with James Rooney, who, he had some interesting theories, and he was, like I said, he was my advisor for my master's, and I was going to get a doctoral with him. And while I think that some of his concepts have been disproven because he was coming at it from a mathematical perspective, he still was one of the forerunners of understanding biomechanics in horses. And he was a really neat guy. I mean, he was a fabulous advisor. I remember him coming to visit me in the hospital, and he was just a really great human being, and I really enjoyed him. And so I think that's probably how I got interested in all this stuff, is way back then.
Yeah, that's actually, I didn't know that you knew him, and I only know his name from Pete Ramey, and, Pete has referenced him in regards to navicular and how biomechanics can influence navicular. And so I've used that name, I'll say oh, Dr. James Rooney in, 1974 or whatever, talked about this and that. And I didn't realize, I guess I never thought about who might have worked with him. So that's really cool that you worked with him and knew him.
Yeah. And, I have to tell you this. So he loved the performing arts, and he had a really great voice. I have such an image of him standing in front of the classroom, and I can't remember it because I was taking his course, right, in biomechanics, as one of my coursework classes. And I don't know what I said, but he chucked the chalk at me like I whizzed past myself. He was a character. He was such a character. And then during Rolex, when, the 3-day event in Lexington, a horse died on course. And I remember doing the post with him because the horse went to K for a postmortem. And I can remember being with him, and he just showed me how you could take a knife and just literally slice the front leg off because there was no bony attachment. He was a really fascinating guy, and he was so animated. And, sometimes you run across teachers that really inspire you just because they're such good teachers. And I think Dr. Rooney, that's, I hadn't thought about that in so long. You're bringing up really old memories. So that's probably what really kind of pushed me down that track, because I wanted to be his graduate student, because I really appreciated him as a person and, had him as a mentor. And I think that that's really, the combination of having a really severe accident where I was now so compromised, meeting Linda Tellington-Jones, learning about the Feldenkrais method, learning there was another way to work with horses, and also knowing Dr. Rooney, that was all that period of time in my life. And, when I look back now, that was such a pivotal moment. Sometimes the accidents that happen to us, and I've known this from the moment that the accident happened, that it was horrific, okay? I bruised 3 inches of sciatic nerve. I was in traction for 10 days. I, couldn't walk for 6 months without, I was on crutches, and I'm still improving that scar. This is 30-something years later. But I knew from the time that it happened that this was a sign to go in a different direction from the way I was going. And it has led me to incredible things. And it led me to Surefoot, which was another 15-second happy experiment that occurred in 2012. So, I think sometimes when we have adversity, we look at the negative side of it and, it's so awful. But if we can flip that around and look at the opportunity that it presents, because we would have kept doing the same thing if something hadn't interceded. We would have just kept doing the same thing because it was easy. And when we are dealt some adversity, it forces us to go, okay, that path isn't working. There's a huge boulder in the way. What direction can I go? And I think that with the pandemic, that's part of what it's all about. Is it's adversity, but it gives us opportunity. And the more we can look at the opportunity, the less we are overwhelmed by the adversity.
Well, it looks like, obviously, it brought you in this really amazing direction, like you said. And I did actually, I reached out to some hoofcare friends and asked them what they would like to hear about from you. And so I think I'm going to start with a big question. And I was trying to make it more specific and wean it down a bit, but it is still like a very broad question. So I don't know how you'll want to tackle it. But what are some what are some of the common problems that you come across in horses that you notice might affect their posture or their movement or their soundness that we might not necessarily recognize as problems?
Well, okay, so after messing with Surefoot for 8 years, I've come away with one major conclusion: that behavior is a balance problem. That behavior problems are balance problems. So as a hoof care provider, if you're dealing with a horse that is having a behavior problem, can't stand, he pulls his leg out from your hand, he fusses, all those things, we have to look at that not as behavior, but as balance. Because when the horse is feeling balanced and secure, the behaviors go away. And I just saw a post come across my feed on Facebook yesterday where a woman had an 18-hand warm blood, and he was really struggling with the farrier, and the farrier was struggling with the horse. And so the farrier told her, about these Surefoot physio pads, and why don't you get some? And she got the physio pads, and the horse stood quietly. And she calls them the magic squares. And so, I was like, that just came across my feed yesterday. I don't know this person. I never taught her how to use it. Obviously we have lots of instructional information out there, but that solved a major problem, which can be so dangerous to the hoof care provider. And this was actually when, we started doing Surefoot, we just have the regular 10 by 12 by 2 squares, right? Rectangle. And then Brad's my guy. He's the designer and a lot of this stuff. He and I went, we want to do something to help the farriers, because if the horse is comfortable, everybody's going to be safer. And that's our primary focus, was how can we make it safer for the hoof care provider, for the horse owner, because if the horse is acting up, the poor owner is getting, what do I do? He won't come back because my horse is misbehaving. But we have to look at why is the horse misbehaving? And it comes down to comfort. If they're sore and you pick up one leg and now they're trying to balance on 2 sore feet and one that might be okay, they're going to misbehave. And so, I think that it's for hoof care providers, if you get hurt, that's your livelihood. You are out of action.
Yeah.
And the most important thing is that the horse quietly stands so that A, you're safe, and B, you can do a good job. Because if the horse is dancing around and pulling its leg out from your hands and fussing, you can't do a good job. You're just trying to get it done.
Right.
And so, Surefoot's not going to solve every problem. Don't get me wrong. I'm not saying that. But, that was just the case. In the majority of cases, what we keep seeing is that when we offer comfort to the horse so that the horse can stand, the behaviors go away and the horse goes, thank you. Like, wow, that was really difficult for me and you just made my life better. They didn't use those words, but it's an action, right? They can stand and they can let you hold the foot as long as you need to. Or maybe you have to put it down because, they're uncomfortable. But we have, I don't even know how many hoof care providers now are using Surefoot. Ida Hammer, Daisy Dicking, Bob Bowker's a big fan, not that he's shoeing horses or trimming horses. In Europe, in the United States, in Australia, we have hoof care providers using foot to bring comfort to make everybody safer. And kind of a little aside from that, Dr. Deb Taylor, Ida Hammer went down to Dr. Deb Taylor's, and they were going to do form a hoof on a hoof, and they trimmed the foot, and then they put the foot on the physio pad, and they watched the cornet band go from slightly curved to straight. And when they took the horse off the physio pad, the cornet band was still straight, and then they form a hoof the horse. So, I don't have enough data on that at this point, but it can be a possibility to use the physio pad during the trim to allow the hoof to make its changes on its own, which then improve before we do another treatment. Does that make sense?
Yeah. And as you're talking about that, because I've been experimenting with it too and using it on, this week I probably saw, I probably used it on more than half the horses that I saw, just kind of experimenting with it and seeing, how it changed, how they stood, or, I guess we'll see over the next few cycles what other changes I see. But I have noticed it has helped a lot of horses stand better. And I wasn't sure if that was just a comfort thing, like, oh, it's a softer surface to stand on. But I guess, this kind of leads into my next question is, the horse is obviously receiving a lot of information from their feet. That's their contact to the ground. It's their proprioception in movement. So how does that information that they're receiving from their feet affect their body? I don't know if you have an answer for that.
Oh, yeah. Well, okay. So this is a great question. How does Surefoot work? Basically, I think what you're asking. And to be honest, I'm going to start by saying I don't know, but I will tell you what I do know. Because this has been my question from day one, from May 2012 till now. And the bottom line is that we don't have, there are people starting to do research on Surefoot, but we can only kind of guess from what we know about how it's working, as opposed to, I can't tell you definitively this is what it's doing. Okay? And it's also the reason why I have now done 130 webinars with Wendy since the pandemic started to try to get information about how Surefoot is affecting horses. So it's something that's a passion of mine to figure out, and I'm not sure I'll ever have a concrete answer, but this is where I'm at today. Bob Bowker was one of the first persons I called when I started doing this. I said, Bob, what's going on? And bottom line, the hoof is a sensory organ, okay? Meaning that it has all kinds of receptors, mechanoreceptors, nociceptors, proprioceptors, pressure sensors, vibratory sensors, graphene, all this stuff. So it is a sensory organ, just like your eyes, your ears, your nose. And it is perceiving information in its relationship to the ground. We also have fascia, we have ligaments and tendons, we have blood flow, so it's this super rich, the hoof is a super rich environment of picking up information. And so when we put a horse on a pad, we are directly influencing that sensory organ, the hoof. Whether it's through changes in fascia, we see changes in fascia. You put horses on pads. In fact, Dr. Martina Neerdhart has done 2 webinars on the changes we see in the fascia, because I've seen fascia curl and wrinkle, and I've seen fascia relax when they're on pads. We see changes in the autonomic nervous system. This is one of the big ones, that you'll see breathing changes in 3 to 10 seconds. You'll see eye blinking, head lowering, ear softening, face softening, muscles relaxing, licking, chewing, sighing, all these signs of parasympathetic response, which is going to be really great for when you're working on a horse. You don't want them in sympathetic. From some of Bob's work, we can guess that there may be a change in blood flow, although we don't have any data on that. So, we're directly affecting the sensory organ and putting in information that is influencing the entire system. And when we're doing Surefoot in the way of awareness and reorganizing, like when we use the regular pads, the rectangles 10 by 12 by 2, you'll see horses swaying, sighing, shifting. And when they walk off, they move different. I mean, they move entirely different. I've seen horses change in 15 minutes, and it's mind-blowing that you can see that amount of change in movement in that short a period of time. What it tells me is they're just waiting for us to give them an opportunity. And, one of my big questions was, well, why, we spend thousands of dollars on good footing. Just imagine, when you go into some of these arenas and you look at their footing and what they've spent on it. And I come along with my little foam pad and I make more change than that really expensive footing. I cannot explain that. I don't understand it. I can't explain it, but I see it over and over again. So, that's my best guess with the sensory organ. We're inputting new information, or rebooting the system is another way I think about it, because I see restoration of movement. But, beyond that, I can't tell you exactly how this is working.
You mentioned people spend a ton of money on footing, and these pads seem to give the horse more information than like the footing that they're moving on all the time. So what makes these pads different from any kind of gym mat or balance mat that you could get and, stick under your horse's foot?
Yeah, no, I get it. And people ask me that all the time. What makes Surefoot pads different? I get it. First of all, we use super high grade materials, and the material in the physio pad and the hard pad and hard slant is the highest rated impact foam on the market. And it's a foam that you can only get through our supplier. They have the formula. So it's the highest impact foam on the market. And, what I have seen with that pad with people and horses is it's so fascinating, because I had a woman who had a headache, and she'd had a headache from a riding accident for 2 weeks. And I put her on the physio pad, and her headache instantly went away, and she went home that night, and she slept deeply that afternoon and deeply that night. And when I saw her 2 weeks later, she was fine. Somebody else has put somebody on a physio pad, and they went from basically, a hunchback to straight. The woman didn't tell him to stand straight. They just put him on the physio pad and they straightened up. When I 2 years ago had surgery I had to have surgery because I'd grown a bone spur where I had all this previous surgery in 84. And when they got in, they found out that glute medius only had 25% of the tendon attachment. So they put in 2 screws and they stitched up into the tendon and reattached glute medius. I could not stand on my left leg for 3 weeks until I was washing my physio pad. And when I was washing it, I was like, because I was going to travel and I needed to clean it up before I put it on a plane. I was washing and I thought, I wonder if I could stand on that, if that would help. And I threw it on the floor and I stepped on it, and I could stand on my left leg for 15 seconds without holding on. And I stepped on the floor, I couldn't do it. And I stepped on the pad and I could do it. There's something about that. And we've gone through over 3,000 different types of foam to come up with the ones that we're using. Like, I went through a lot of stuff and rejected, we have 4 different foams. So I rejected 2,996. But we went through a lot of materials to come up with the ones that we're using. Some of them are medical grade. That one is the highest impact foam on the market. So, we're just finding that there's something about that impact foam. And this is where I am at this point. I could change my thoughts tomorrow, but where I am at this point is I think the impact foam is able to take the hit. It's able to, in some cases I see it take the trauma, right? And allow the body to organize around that in a way that feels stable and secure. I don't know if that helps, but all of our products are warranted against delamination and breakage. So, it's not like you're buying a pad every day. You're buying a pad and, it's going to get nicks and tears and cuts. These pads are tough. They're going to get beaten up and they'll keep on working. So yeah, I've spent a lot of time in R&D on these things. I've tested them. I know they work. I stand by them. And, I can't explain some of the results that we see with our products. I just know they do work, that they work.
Yeah, I'm seeing it too with even just like the short amount of time I've had to play with them. So it's really cool. Another question that somebody was wondering is, and you had touched upon it in one of your answers. So how does using these pads statically, so like when the horses are standing still and they're standing on them for, however long they decide to, how does that then affect their movement right after? Like you said that they can walk off and move differently instantly.
And yeah, and I wish I knew the answer to that one. I mean, this is what's so mind blowing, because the first horse, how I just, I was talking to Joyce Harm. I had a horse that was compromised in the right hind leg from the saddle. We switched the saddle back in the lesson. The horse was still compromised, short in the right hind leg. I went home that night, talked to Dr. Harmon. It was like, she wanted to stand at a computer instead of sit. She talked about standing on a pad. She told me about how they were putting dogs on pads, and that's how it all started. So I grabbed something out of my shed. I drove to the lesson. I timed it for 15 seconds, and that horse walked off different. And in an hour of just messing around with only his back feet, the horse was moving completely different. I cannot explain that. I wish I could. But I just had a horse at a workshop 2 weeks ago. His name was Lars, and he was an Amish driving horse. He's like 18 hands, and his neck was straight up, and he looked like a giraffe because his rear end sat lower than his withers, which sat lower than his head. So he was like, she has actually came off of him just because she slid off of him one time. The woman had this horse for 3 months, and this is how he was just fox hunting him. And he was my demo horse for the workshop. I put a hard pad, which is the 2 inches of the hard material, under each foot. I did it a couple of times, then both front feet. He stood quiet, so I let him stay. And he probably stood there for about 5 minutes. And when he walked off, his neck was down. And the next day when he came in the arena, his neck was down. And he was reaching into the contact. That was one session, I don't know, 20 minutes. And the next day he's totally different. And the owner was just, and this was in front of this wasn't like just privately. I had, 12, 13 equine professional body workers there watching, and so I don't know. It's taken over my life because I don't, but okay. So guesses. What are my guesses? The horse has a huge cerebellum. Balance and movement are imperative to his survival. He's born with a program, and he grows up and he's moving it in the field, and hopefully he's a foal that gets to run around with other foals, and so he's moving. And then we come along and we teach him how to drive and put an overcheck on him, or put him in shoes that may or may not be a good trim. And then I think that all of this stuff is kind of like magazines piling up in the living room, and they pile up and pile up and pile up, and they cover up the floor. They cover up the original programming. And in those cases, I mean, literally, that horse in 5 minutes completely changed. I think it's like Surefoot comes in and just sweeps away all the magazines and resets back to the floor. Because I've seen it so many times. I've seen crazy things where horses just, went from twisting their heads totally sideways, and in one 40-minute session of standing on pads and walk, trot, canter in between, perfectly straight. Next day, perfectly straight. Never went back. So, there's something in humans and people. I mean, I've taught riding for over 30 years, and I work with people to help them change habits. And I get like, I can't do that. That's slouchy. I can't sit up that doesn't feel right. I get all this story, and horses can't do that. They don't have the brain to do that. It's just not there. They don't have the frontal lobe. So when they're presented with something that feels better, or maybe triggers an old memory, they just go right to it. As long as there isn't if there's pain, if there's acute issues and stuff, of course they're not going to be able to maintain it. And not all horses make that kind of change in that short a period of time. I think it has a lot to do with when did the insult happen, what has happened in between then and now. But Lars was a driving horse for years in Amish country, and he just changed. So I can't explain that. I wish I could.
Yeah, and so I got into hoofcare because my horse had soundness issues. And I think a lot of people get into, various aspects of rehab because they're dealing with a horse that has soundness issues. Obviously, it would be nice to prevent that from getting to that point where, a horse has outright breakdown of their movement. I don't know if you have any ideas of subtle things to look for that might show that a horse is in some form of discomfort and you need to intervene sooner rather than later before it becomes a bigger problem? Because I think a lot of people just wait until there's actually an issue that they're struggling with. Do you know what I mean?
Well, it's so difficult sometimes, because so often the owner recognizes something's not quite right. And then they call the vet or the farrier and they're like, you can't see it or feel it because it's really subtle. But you have to trust your gut. And Dr. Hillary Clayton always said that the first sign is a loss of suspension. So that's a problem with a gaited horse because there is no suspension. But with a 3-gaited horse, the first sign is loss of suspension. So you're like, my horse feels a little flat. That's the first sign. Horse owners typically know their horses really well, and they know what their horse feels like normally. And so they recognize something's not quite right. But the question is, what? It's not always easy to figure out. I mean, where I live, Lyme disease is rampant. Limey horses can feel flat and dull or woody or, and you're like, my horse doesn't feel right. Then you kind of go to your vet, my horse doesn't feel right. Well, we'll do some flexions, we'll do this and that. But it's the subtle, tiny little things, and we start to pick them up. And the thing is, it's really important to trust your gut. If you feel like your horse isn't right, most likely he's not right because you know your horse. But then it's a question of figuring it out. And, Surefoot can be helpful in that way, too, because I've watched a lot of horses and I've put them on pads, and it's, it's like, okay, if it's not getting better, or sometimes it actually gets worse. And I had one horse, we were doing the lameness locator with him, and the horse was lame, and we put him on pads, and the horse got worse, and the vet went, oh, soft tissue injury. So, it really helped him with his diagnostic. Yeah, I was like, whoa, that was fascinating. If you see, your horse standing on Surefoot pads and he has a regular pattern, and then one day he's like, nope, I don't want to do it. Oh, that's a big clue. That's a big clue. We'll see horses that I was doing a demo with one horse, and she had been my perfect demo horse for videos like a few months before, and then that day she was like, nope, I will not stand on your pads. I'm like, okay, another horse. But then the chiropractor came and went, oh yeah, she's out here and here, she needs an adjustment. And then she was fine again. So I'm not saying that Surefoot's going to tell you exactly what's going on, but if you know your horse, and if you're using Surefoot with your horse regularly and you see how they stand, and then one day it's like, that's not happening, or they want something else. It could be a positive thing that they've improved, and now, it depends on what you're seeing in front of you. Or it could be that you need to think, oh, what happened? I overworked my horse yesterday. Oh, yeah, I did that hill work, and today's not so comfy.
Yeah, and something that I come across a lot, I'll come to horses and notice, or I'll have x-rays on horses, is that I think seriously affects their movement, is I see a lot of horses with negative plantar angles, which, the hind feet. And yeah. I've had, when I asked some of those hoof care friends what they wanted me to discuss with you, I had multiple people ask about NPA. And because we as hoof care providers, there's only so much we can do to the feet. If there's not a lot of sole depth, we can't just, chop off the toe and get them to have a positive angle. We can try to increase the height at the heel through, wedges or whatever. But ultimately, it seems like we're chasing after a symptom. There must be some sort of cause or issue. I usually think there's something going on higher up. But I don't know if you've come across horses that have NPA and, seen or had success with them, or seen your pads work with those horses.
So I'm going to tell you what I know, because I'm not a farrier. I'm not a trimmer. I do trim my own horses, but, I'm just a horse owner trimming my own horses. And I've been trying to figure out this hoof thing for a long time, and that's why I have so many hoof care practitioners on my webinars, because I'm still trying to figure it out. So I'm in the process of learning, and I just want to, that's my sort of disclaimer here. What I know is that when I put a person on our slant pads, so we have hard slants and firm slants, and I like the hard slants because they're going to hold the angle more than the firm slants that they're going to give them. Okay, but that's just sometimes it's appropriate to use hard and sometimes firm. But when I use the slant, so they're 3 inches at the back and they go down to nothing at the front, and I put a person on them heel high, and I have them soften their knees, because we can lock our stifles in a way that horses can't. So I have them soften their knees. Everybody reports to me that their lower back feels better. And when we have pads for dogs, and when we put the dogs on the slant pad, feel high. The massage therapists that have been working with it report that the psoas muscles soften. So it would seem to me that some of this NPA, I get the language down, I would, in my humble opinion, agree that there's something going on higher up. And it could be, a saddle issue, back, there's a lot of things that can be needing attention. But what I also find is that when I put horses on slant pads, heel high, they like it a lot. And if I could conjecture from what I know in people and dogs, is it possible that we're going to alleviate some lower back discomfort, alleviate some psoas tension? The thing is, there's no way you can feel that, or I can't feel that on a horse. The psoas is way, way, way deep. There's a lot of body. So I can't palpate a psoas muscle. I'm not trained to do that. I don't know, maybe somebody else can. But I do know that we see positive results. And Dr. Rachel Bellini has done an entire webinar on using the slant pads with horses. She's a veterinarian who's a holistic veterinarian, and she uses Surefoot as part of her treatment. And so we do see that. And I think that if you're chasing something like NPA and you're doing all that you know how to do as a hoof care provider and you're not seeing an improvement, clearly there's got to be some other cause. And, for me, the first thing I would think about is back pain, pelvic pain, anything there, because you watch people and what do? They start to stand and try to, find a way to make their back feel better, and they do all kinds of odd things, right? Straighten their knees, go back behind the knee, and which would drive your heel down. And so for me, as a, understanding function in people and what I've seen in dogs and people, I would think that would be helpful. And when I say helpful, that's something that the owner needs to be doing with their horse, because you coming in one time every 4 or 6 weeks and doing that isn't going to be enough. But that's where if we can get the owners to start using Surefoot in between the visits, and we've seen this with many horses, then we keep the positive cycle going. We keep offering the system a reset. We keep providing it other information. And hopefully we can kick the thing into a positive spiral where you start to gain on the thing and on the problem instead of, continually just coming back and it's the same thing over and over, no matter what you do. Because if what you're doing isn't making a difference, then there's got to be something else causing it, or another, at least, big chunk of the puzzle that hasn't been addressed.
Yeah.
In my humble opinion.
Yeah. And actually that sort of leads into my next question is, if we're using this when we're going to work on the horses, how can we use it to influence what we're doing to the horse in terms of our trimming or shoeing?
We had a vet put a pad on top of their x-ray block and take an x-ray. And they sent us the picture of the horse on the regular block and then on the block with the physio pad on top. And what was so amazing was that on the regular block, you couldn't tell how much weight was being distributed or where it was on the foot. But when they were on the physio pad, you could see that the heel was way high and that the weight was on the toe. In other words, you could see the loading, the way the foot was taking the weight, which you could not see on a regular block. Because on a regular block, the foot is flat, right? But you can't see how much weight is on the foot and you can't see where the weight is. But with the physio pad, it deforms. And so you could see this horse was standing mostly on his toe and not on his heel. It's like, oh, wait a second, this horse is only standing on his left front foot. He's really not weighting his right front foot at all. So yes. So we're actually making an x-ray block. We're going to call it the physiograph block, which is going to be physio pad on top of an x-ray block so that you can see this. But in just everyday use, yeah, I mean, you can use the pads to look at the impression of the foot. Now, do I take one impression and base all of my thoughts around it? No. I might walk the horse off and come back and do it again, because what I do know is I've seen horses in 15 minutes of just, stand on the pad for 30 seconds, go for a walk, come back, stand on the pad. In 15 minutes, the way they load the foot is completely different. I've seen it change dramatically. Is it good information? Absolutely. Is it also, in a way, causing a change? Yes. So, like down at Dr. Taylor's, they trimmed the horse, put him on the physio pad, took him off the physio pad, and the foot was in a different shape than before. It somehow allowed that foot to find a different level, and then they formed the hoof it. So, obviously, you can't spend your whole time trimming your horse and putting in a pad and doing a little trim and putting that. Obviously, you'd never get done, right? But as a tool, the more insight we have, the more sort of and I always think about, does the piece of information fit what I already know? Or is it so out of the box that I have to go, wait a second, this is right? But does it help give me a little more information? Because you get to see the way the weight is coming down on that foot, because it makes an impression on the pad. And when the horse steps off, I think of it like a clock, and I can see, oh, look, there's a lot of pressure at 3 o'clock, or, oh, back here at 5. Or it gives me another view, another piece of information. Now I actually have to look at the foot, right, and say, does this fit with what I'm seeing with my eyes? And the reason I say that is because Dr. Herman had the computer pressure pad, which we used to use to look at pressures on the horse's back from the saddle, right? But you still have to look at the saddle. So you look at the computer image and you see, oh, there's high pressure, but you have to look at the saddle and go, oh, wait, the saddle's dropping off to the right. That's why the pressure's on the left, So it's another piece of information. It's another piece of data. And it may also influence the horse to start changing the way the horse is standing on his feet into a better pattern. That's why having people use it in between is so handy, because we're constantly giving the horse an opportunity to become self-aware, reorganize, rebalance, find another stance that's more functional, that's greater ease. And what do horses do? They seek ease. So if something feels better, that's what they're going to go toward, right? We as humans override that all the time. Oh, this is easier. No, I can't do that. My mother said I have to do it the hard way. But horses don't do that. If it feels better for them, they're going to go that way.
Yeah. So, for somebody who might not have any of the pads and they're trying to figure out, this, sounds all really great, but where to start? Because I know you have so many different kinds.
Okay. So we do. We have the standard pads, the 10 by 12 by 2, the rectangles, come in packed in pairs, and we have 6 different ones. So we have 4 densities: hard, firm, medium, and soft, and then 2 styles, slant or flat. And the slants are only coming in hard and firm, because when you get into the other materials, it just won't maintain a slant, right? So 4 densities, 2 styles. Oh, and you can flip 3 of them over, and so you have another surface. But if you're a trimmer, what you want to do is offer the horse comfort. And so I tell people, just start with a half physio pad. Start with something simple. See what happens. The difference between a half physio pad and a full physio pad is dimensions. So half physio pad is 16 by 12 by 1.5 inches, and a full physio pad is 24 by 16 by. So it's just twice as big, right? You can put 2 feet on a full physio pad. But I tell people, just start with a half physio pad. See what your horse does. What do you got to lose? You've got a lot to gain. You don't have a lot to lose. And the thing about the half physio pad, which, just think about you when you start to worry and then you build it up in your brain, if we can alleviate some of that by triggering some neurochemicals, which obviously we see neurochemical release because that's all the parasympathetic signs that we see, the licking, chewing, sighing, breathing, right? If we can elicit that in the horse, it's at least going to make the horse more comfortable. And if the horse doesn't want it, they won't stand on it. Okay, it's not about forcing them. It's about offering to them. Would you like to stand on this? So I think of it as kind of our little emergency pad, And like I said, we put people on it and seeing headaches go away and postural changes. And what do you have to lose? A non-invasive way to help the horse. And I think that, when we look at the benefits involved, it's not going to work for every horse. Nothing does. I will not make promise that it's going to magically transform your horse. I just know that it's made a significant. Otherwise, my life has been totally taken over by this thing. And it's the horses that drive it, because if I listened to the people that told me, you're crazy and blah, 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 I wouldn't be doing this. But I listen to the horses. And the horse after horse after horse tells me, oh, so cool.
And I think I could ask you questions, I think, all day, because it's so fascinating to me. And now I'm so new to it that I have so many questions, but I think that, this is a really, really good start. And I'm really thankful that you were willing to hop on this phone call. But
oh yeah, I'll always come back. Anytime you want to. Obviously, I can yak forever. So.
Oh, me too. So I totally get it.
Okay, thanks a lot.
All right, great. Have a great rest of your day.
You too.
Bye.
Bye-bye.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoofcare podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.